If we will turn to our moderator, Jonathan, at this time. Jonathan, to you.
Thank you, Lieutenant Governor. This is our public recovery town hall here, hosted by our Lieutenant Governor, Bethany Hall-Long. We've been hosting a series of these town halls, as well as small business recovery town halls. We appreciate everybody for joining us. We would ask that you visit de.gov/economy to learn more about Delaware's reopening and recovery effort. There's also a form at the bottom of the page where we would ask folks to fill out and offer your feedback and help inform that effort as we look to open Delaware's economy. I'm going to turn it over to Lieutenant Governor here in a second for opening remarks, and then we're going to spend most of the time taking questions from you out of the comments as well as pre-submitted questions. So now I'd turn it over to our Lieutenant Governor, Bethany Hall-Long.
Well, good evening, and many thanks for joining our third Community Economic Town Hall. I'm Lieutenant Governor Bethany Hall-Long from Sussex, which I know our focus is this evening originally. And I'm happy this evening to be joined by our Secretary Cerron Cade of the Department of Labor, my friend Dr. Rick Hong from the Division of Public Health, and Damian DeStefano, our Director of Delaware's Division of Small Business. Governor Carney announced a series of our recovery town halls as we've been able to engage Delawareans and our businesses to really try to safely open Delaware's economy. As our governor has said many times, we need to have a healthy community again before we can have a healthy economy. But we need to have a plan to move us forward. So tonight, we want to gather your input, your thoughts, and how we really can open safely when the time is right. We know all of our lives have been changed over these past few weeks. How we function and really how we operate every day has been upended. So as we move forward and we work together to create a plan to reopen, we need to have that balance between opening the local economy and ensuring Delawareans are safe and overall healthy. That means kind of a new normal, and it's going to look very different than it did before for many of us. So this evening, I'm really thrilled that we're joined by many of our local elected officials. Many of them, you know personally, you see them around the beach community and the towns in Sussex on the western and eastern side of Sussex. And tonight we're joined by our Speaker of the House, Pete Schwarzkopf, our Minority Leader, Danny Short, the Minority Whip, Tim Dukes, and Representative Smick, Vanderwijk, Shoup, Briggs King, Gray, and Collins. From our Senate, we have our Minority Leader, Gerald Hocker, and Senators Lopez, Wilson, Pettyjohn, and Richardson. In addition, I know from our local communities who've been very committed to getting it right from the beginning, many members of our county council, many members from our cities and municipal councils in Sussex County, as well as others across the state this evening who've joined us to really stand up to fight against the pandemic. We also have been joined by other secretaries of state and their cabinet, or secretaries of the cabinet, I should say, and including our Secretary of State in his office, but for other individuals who are really concerned about Delaware's economic reopening. So we really want to hear from you about your experience, your thoughts, how it will best inform us as we move forward. If you're just tuning in to our Facebook streaming, you may have missed the fact that you can go to de.gov/economy. Go there, fill out the form at the bottom of the site also, please. And we also want to let you know that we may not get to every question, but we are going to try to listen, get back to you, and get feedback, particularly to those who submitted questions in advance this evening. We'll be posting a link later where, again, you can find details about Delaware's economic reopening effort. And as always, before we get started, we do want to highlight some of the information. We know lives are being lost and impacted greatly. And last week, particularly for those of you in Sussex, Governor Carney declared a COVID-19 hotspot, which really has called upon our community for expansion, not only of testing sites, but your help in really implementing the executive orders that our governor has put in place. As a result, public health, and tonight we'll hear from Dr. Hong, have been really working with a team of experts, actually some who were deployed to us from the Centers for Disease Control and Prevention out of Georgia, to help us in our hospital systems here in Sussex. And a shout out to our hospital systems, our first responders, and all of you on the essential front lines in Sussex County and again, statewide. Many of you have been fantastic about putting on your face coverings when in public and really following the governor's modified executive orders. Again, I'm sure we're going to have additional questions on some of these changes that have happened in the last couple of days. We're prepared to answer some of those this evening. And again, please make sure you participate in the conversation tonight. A special thank you goes out to, again, our first responders and providers. And I have to be a little selfish as a nurse this evening. I have to give a special shout out to the colleagues, my nurse friends on Nurses Day and National Nurses Week. We really want to thank you all from the bottom of our hearts for the work that you do every day on the front lines. So, it's now time for us to get down to the business of why we're here this evening. And I want to turn it over again to Secretary Cade, our Secretary of Labor, who will then have a brief remark from Dr. Rick Hong, who will then have brief remark from Damian DeStefano. So at this time, I want to turn it over to our Secretary of Labor. And again, each of them are going to give brief introductions and we'll be right back at questions. So to you, Secretary Cade.
Thank you, Lieutenant Governor Hall-Long, for inviting me to address the group today. The Department of Labor, as well as other state agencies, have been on the front lines trying to address the coronavirus, as well as the resulting activity that's occurred due to the shutdown and the stay-at-home order from the governor. The Department of Labor has received over 80,000 unemployment claims to date, and we have issued over $140 million in unemployment benefits to workers throughout the state. We still have a heck of a lot of work to do. We've just announced the rollout of the new Pandemic Unemployment Assistance Program meant for independent contractors, and I'm sure we'll get into a little bit of today. And we continue to issue the extra $600 benefit that the federal government has provided under the CARES Act, as well as a 13-week extension of unemployment benefits. Throughout this process, we have been working around the clock to make sure that we can address many of the concerns and troubleshooting efforts that are taking place in order to make sure that we can process the historic number of claims. So we look forward to your questions today, and hopefully we can create some clarity as you navigate this process. I'm going to turn it over to Damian DeStefano, Director of the Division of Small Business. Damian.
Thank you, Secretary Cade and Madam Lieutenant Governor. My name is Damian DeStefano. I'm the Director of the Delaware Division of Small Business. And like Cerron, our organization has tried to be on the front lines of helping small businesses. We've launched a financial support program called Help Loans to try to help those in the hospitality sectors and cosmetology sectors. We've been fielding lots of calls from businesses in all sectors trying to answer their questions, businesses and employees trying to answer their questions and trying to provide support during this difficult time period. We've heard from many of you. We know the frustrations and the challenges that you've been facing and want to make sure we're getting you the information you need to help at this time. With that, I'll turn it over to Dr. Rick Hong.
Great, thank you very much. Thank you. This is Rick Hong. I'm the State Medical Director for Division of Public Health. I apologize for not having my video on. I'm having technical difficulties with my camera, but I assure you that I am here, usually very eager to kind of answer questions out there regarding health. We as Division of Public Health are interested in opening up the economy as well, but we want to make sure we do it safely and correctly. We want to make sure that people remain safe while we are reopening the economy. There is a balance between the two. Our main concern is that if we don't do it right, that we're going to see a surge of cases and we're going to have to go backwards. And I don't think any of us really want to do that. So we appreciate everyone's patience in this as we evaluate small steps, how we can open up the economy. But I also want to mention and also thank the public for your help in this, because we cannot succeed without your help regarding infection control measures, social distancing, hand washing, things like that. Each of us has a role in this, and we need to work together and make sure that we can successfully reopen the economy. Thank you.
Great, thank you. I guess then we will go to Jonathan to start our question period of time.
Thank you very much, Lieutenant Governor. And obviously, as Lieutenant Governor said, tonight's public town hall is focused on Sussex County. So we're getting a lot of questions, not surprisingly, about the beaches. Donna, in the pre-submitted question, says, I'm concerned if we open Rehoboth Beach before June. Memorial Day is a giant free-for-all here, and we don't need that. Donna also expressed some concerns about the opening of the beach in Ocean City. Lieutenant Governor, do you want to start on that and talk about beaches? A lot of people are thinking about beaches when they may open. Any thoughts you have on that?
Absolutely. And we've heard this comment about the beaches along our entire coastline, whether we're looking at the riverfront to Wilmington to Pickering Beach to Bowers Beach, all the way down to where I grew up, hence my name. The beach area is an important area. And I feel very strongly that we will make the right decision when the time is here based upon the governor's leadership with the region. Our governor has spent an incredible amount of time working with Governor Hogan and other leaders who are listening tonight. You did not hear me mention all the mayors and all the members of city council, because we have a number from the towns and the cities on this evening to answer the questions who are coming in about that regard. Our governor tomorrow will have another meeting specifically with mayors who represent those communities from the beach communities in Sussex County. And I am convinced that together in coordination, not only with Maryland, but New Jersey and our sister states, that we will come to, I think, a safe decision. You heard Dr. Hong talk about doing things safely. And please keep in mind that Delaware has had open the beaches for physical distant activity, whether you're walking your dog or whether you are jogging, but it was done for public health reasons. And please know that that debate and that discussion, I think, will come to some type of a resolution in the very near future. So I don't know if anyone has anything else to add to that. And if not, Jonathan, I would encourage you to probably go to another question.
Thank you, Lieutenant Governor. I think this next one is for Damian DeStefano over the Division of Small Business. Donna Ray, also in the pre-submitted questions, asks about the May 15th date, and will businesses like spas and massage parlors be among the last to open? This is a little bit different, but I know we've heard this before. Donna says she works at a front desk for a massage business, and she does not feel safe going back to work. Damian, can you talk a little bit about what we've been hearing and public acceptance of reopening of the economy and how important that is?
Sure. Yeah. So it's definitely something that we've been having a lot of conversations about. I mean, we've been having conversation with business owners who are eager to get back to some level of operation, those who were shut down as part of the containment efforts. But we've also been getting those questions of how do we instill confidence in consumers and in staff that what we're doing is creating a safe workplace, is creating a safe storefront, restaurant, bar, and other businesses. And so I think that's why it's critically important that we are working both with industry as we come up with some of these plans, and we're also working with our public health officials so that when we do release the guidance for phase 1, for phase 2, and for the later stages of this, folks have confidence that they were reviewed by people who are the experts in this area, and that they can feel safe if the guidelines are followed, that they'll be well protected. And so I think that's the critical thing and piece of our efforts.
Damian. And Secretary Cade of the Department of Labor, a question for you, and this is a one we've heard in our other public town halls as well. This comes in from Eric Hearn in the Facebook comment section, who asks generally what kind of federal support we have for the unemployment benefits and generally the budget impact of the unemployment benefits. You talked a little bit about the number of claims. Can you talk about budget impact and what support we have from the federal government to cover that?
That's a great question. So what I would say is that for starters, the federal government through the CARES Act provided reimbursable dollars for a certain number of benefits that are paid to workers in our state. So initial claims, initial benefits, as well as the added $600 benefit that on top of that. Federal government has also provided opportunities for loans from the United States Department of Labor to the Unemployment Trust Fund to ensure that we have cash available to make payments to workers who are in need right now. On top of that, the state has received $1.25 billion through the CARES Act that are essentially dedicated to costs encumbered as a result of the coronavirus. That would include unemployment. So our share is an estimate, could be anywhere from $350 to $400 million to cover that cost. And we expect that the part of the $1.25 billion that the state received would be able to be used in order to cover that expense. This is going to be a deeper conversation than just federal assistance when it comes to the Unemployment Trust Fund. The trust fund has not been solvent for a while. We had this issue coming into this crisis, and we're going to have it coming out. And so until we make some tough decisions as to the current tax system for unemployment, then we're not going to solve this problem alone with just federal assistance, at least not in the long run. Luckily, the General Assembly passed a law at the end of legislative session in June last year, where they provided a directive to the Unemployment Advisory Council to come back at the end of this year with suggestions and recommendations as to how to address the state's unemployment tax system in order to create a long-term solution to the trust fund solvency. So our expectation is that that group work will be done. I don't think at the time that we did it, we had any understanding of how important that group's work would be at this time period. But that work should be done by the end of the year. We should have some recommendations to come to the legislature with hopefully some long-term solutions.
Thank you, Secretary Cade. Here's a question for you, Dr. Hong, over at the Division of Public Health. It's a tough question from Jay Flack in the Facebook comments, who says, why don't you allow adult citizens to make their own decisions? Jay says, if I don't feel masks are safe, why would I wear them? Can you talk generally about the science behind face coverings and the science behind all the restrictions that we've put in place in the state of Delaware?
Absolutely, and it's a tough request that we are making because we are asking individuals to make sacrifices for the overall public good. The recommendations that we have provided are all vetted through the federal government as well as through our individual investigations with science, previous experiences in other countries, and so forth. I understand that the issue with the mask, the mask is really to prevent droplet spread when people are talking, sneezing, or coughing. So it's really to protect others while you're wearing the mask. Versus in healthcare, we wear the surgical mask. It's supposed to protect the user as well as people around the user. Social distancing is something that's been shown to be helpful in previous pandemics and previous outbreaks, where since this is a disease that spreads through droplets, which means coughing, talking, spitting, that we want to make sure that there is enough separation among folks, which is defined as 6 feet, to prevent that spread of illness. We do understand the sacrifices being made, but we assure you that these recommendations are not unscientific. They're not made up. They have been proven in the past from previous experiences, as well as through our experts at the federal, state, and local level.
Thank you, Dr. Hong. And another question on masks here that I think I'm going to throw to the Lieutenant Governor. Bridget says, in other countries, that there's been an option for folks to buy N95 or surgical masks. Is that anything that Delaware is considering? And I know that we've asked Delawareans to not wear surgical masks and N95 masks. Can you talk about that and why we've steered them away from medical masks?
Yes, absolutely. As you just indicated, they are meant for healthcare professionals. At this time, if we had certainly a surplus, that would be one indication. But we have heard and we've seen not only in Delaware, but in other states and across our country, persons utilizing their N95 mask over and over again, which is not normal practice. It has been normal practice in infectious diseases in the past. You go into either a client's room or a client's home where you needed such a device as a mask, you were able to discard it when you were done. We are now in a situation where we're in a critical need and to protect our frontline health workers, such that when someone is ill, that there are individuals to provide that bedside care or that care in the emergency room. And so we've asked nicely, and I think Delawareans, that I have seen, have done a decent job of not inappropriately using the N95s, but respecting that they should be for frontline health workers and responders. And so again, those are the masks that have the little metal clipping, as opposed to the other cloth or the other types of masks that you can wear. And again, one of the most easiest preventative things to do is have that mask, socially distance, and wash the hands. Amazing, while we wait for the vaccination and or a treatment method. So thanks for that question.
Thank you, Lieutenant Governor. So here's another one for Damian over the Division of Small Business. Carrie Welsh asks in the Facebook comments, why can't small retailers like shops or boutiques open with guidelines around fire capacity? She mentioned South Carolina with a limit of 5 people per 1,000 square feet. We've talked a lot about this with small businesses. Can you talk about fire capacity and some thoughts as we move toward phase 1 of reopening?
Yeah, sure. So the first thing I would say is we did announce some interim steps this week, allowing some retailers, most of the retailers who are currently shut down, to operate via curbside pickup, which has been something many have asked for, and will hopefully be a little bit of a help to some folks in the interim here as we await a transition into phase 1. I think the fire code limits are something we're really looking at as a guiding factor in how we structure the phase 1 guidelines for retail operations. We've used them for some that are open right now, the fire code restrictions, and they've been effective at keeping the numbers of people. It's I think something that's really clear for the business owner to understand. They can count the number of people in their store. They know when they're close to the limit. It's also, from a social distancing perspective, I think enabled, if you have less people in the store, easier to police, easier to make sure for the shop owner to police and make sure social distancing is maintained with all the customers. And so I think it's a system we're really looking at as we build those phase 1 guidelines.
Thank you, Damian. A question that I think we'd want Dr. Hong at the Division of Public Health to weigh in on, another one that we've gotten a few times, this time from Sean Garahan in the comments here, who asked, is the governor considering opening the state county by county versus statewide and all at once? I know some people have seen this sort of thing in Pennsylvania. Dr. Hong, can you speak to whether that's a realistic option public health wise in the state of Delaware?
So I think all options are being evaluated at this time. There have been discussions about opening the entire state at once or opening by county or certain locations at a time. One of the biggest concerns we have if we do it bit by bit is that will there be a surge of cases due to travel? I can imagine the possibility that if a certain county or area opens up, would there be a flood of folks going to that area? Is that going to break our preferred infection control measures? So, we are looking at all options, but we are, again, our main goal is that if we decide to open, however we want to open, that we do it safely and we do it correctly and we do it once and final time. Thank you.
Thank you, Dr. Hong. And a few questions here, Secretary Cade, for you about independent contractors. And I'll just ask it in a general way. You made an announcement recently about independent contractors and benefits. Can you talk about for independent contractors as it relates to unemployment and the timing around that?
So the way the system will operate is individuals who are independent contractors or self-employed or folks who work for faith-based organizations are being asked to apply through the traditional system. The federal government is requiring that the state of Delaware and all other states, of course, first verify that the individuals do not qualify for traditional unemployment. The quickest way to do that is for you to just simply apply through the automated system or through our traditional system, rather. That system will interface with our new system that has been being designed or has been designed by an outside vendor, and will provide that system with all of the information of the applicants who have been flagged as being independent contractors, self-employed workers, or folks who would typically not qualify for traditional unemployment. Once that occurs, those people will receive a notification or a letter in the mail that will alert them that that process has been completed for their particular account, and will provide them with credentials in order to log into the new website, in which case they will log in, apply for benefits through the Pandemic Unemployment Assistance Program, and those benefits will be processed and they will receive a check or a direct deposit of benefits that will be backdated to March, the week of March 5th, in which, basically is the time that the governor issued his first amendment to the state of emergency. So that is in general how that process will work. We expect it to move pretty quickly. However, there may be individuals who have issues associated with proving their earnings or getting through security verifications. So we expect, but outside of that, we expect the process to move pretty quickly.
Thank you, Secretary Cade. Another one about the beaches. We have lots of stuff, as you'd expect. We're focusing tonight on Sussex County, so lots of questions about the beaches. Dr. Hong, I think I'll start with you here and then go to the Lieutenant Governor. Yul Lee in the live stream comments asks, if we open the beaches, what restrictions or provisions should the public expect? And maybe we can also just talk about the new normal and social distancing and face coverings, perhaps staying around even as we open the economy. But specifically, Dr. Hong, if we open the beaches, what restrictions or provisions should the public expect?
So that's a good question. So we would think that we would implement the current infection control measures that are being recommended at this time for businesses, for basically everyday activity. So social distancing is going to be a challenge if we open up the beaches. So, to successfully do that, we do need the cooperation of everyone so that we can keep the beaches open and safe. So social distancing is one of the most effective ways to prevent transmission of this disease, given the fact that it's spread through droplets. Face coverings will also be another option as well too. And also we may work with other local businesses to try to maintain the volume of customers that enter their stores. So, still early on, but those are some things I do anticipate we're going to discuss if we decide to open the beaches.
Thank you, Dr. Hong. Lots of questions here, Damian, about second homeowners and whether second homeowners, folks from out of state who have a beach home, are allowed to travel to the state of Delaware, and when some travel restrictions might be lifted. Can you just talk specifically about what second homeowners can do today and how maybe that's factoring into the reopening planning?
Sure. So the current guidelines are that if somebody comes from out of state, even if they're a second homeowner in Delaware, they need to quarantine for 14 days in their location. So that when they come, they go to their house, they need to stay there for 14 days. That means even getting food delivered to the house or groceries. That we have in certain cases when folks have asked if they can come for maintenance that they need to do on the house, to just inspect the house and then leave and go back to the state that they are from. We have allowed that without a 14-day quarantine, just a very short-term visit to the house. I think as we move into phase one, we're going to continue to look at the restrictions around that, both in how they deal with somebody coming to stay at a home. I think non-essential travel is still restricted in phase one. So what we don't want to see is people coming from out of state to go on vacations, maybe rental properties, things like that. So that's something we're looking at. As you move into phase two, you do remove that barrier on non-essential travel. So there might start to be some relaxation of those things. But for the time being, we're going to have to remain vigilant and encourage those from out of state to try to avoid coming if at all possible.
Thank you, Damian. A question for you here, Lieutenant Governor, which I think is a big picture question that a lot of people have. Dan Lehman, can the group talk about what it means to be healthy? He's high unemployment, joblessness, economic damage also comes with health ramifications. I know this is something you've talked about in other town halls, and the governor has said we need a healthy community before we have a healthy economy. But can you talk about that balance that we're striking here?
Absolutely. And I know Dr. Hong can fill in as well that it's so important as we are experiencing, whether it's the stress of being at home, homeschooling, and unemployment, and as an employer not getting out. And that's why during this time, there really are, a couple components to this question. There are two facets to this. One is your own personal health and well-being, calling 211, visiting de.gov/coronavirus for resources. We have a number of services for persons who are experiencing social isolation, anxiety, and depression. And also, we have seen an uptick, unfortunately, in the use of other substances and in our overdose death rates statewide and countywide. That is one component. The other component, to my good friends and family who are in Sussex, and we often hear our governor speak about his mother who has many children, who's in her social isolation. Many adults who are in Sussex also have that same isolation. And the fear we see, in Dr. Hong, who is a practicing emergency room trauma physician, will also tell you that we have seen in the past 8 weeks individuals who've also put their other health conditions to the back burner. We have respected that the emergency room not be filled with the worried well, that you're there with a high fever or respiratory distress, but we have had individuals with cardiac issues and other issues that they've put to the side. So we encourage you to know that your physician's practices are up to standard. They have masks, they have hygiene, they're scheduling appointments. So if you've been neglecting visiting your endocrinologist for your diabetes, or you've been neglecting your cardiologist, please don't continue to ignore. You can safely go get testing. So we had those two extremes, your mental health, your physical health, and respecting the healthy balance of not filling our emergency rooms with the worried well, but doing things safely. So again, a lot of information, turn to 211, and also a shout out to the hospital systems statewide, but in particular to Nanticoke Bay Health and Beebe, as well as our mental health facilities in the state, Sun Behavioral Health, and others in Sussex who've really stepped up. I don't know if Dr. Hong, if I missed anything, or did I cover that okay?
No, you did a great job, and I am so thankful you did mention the concerns that we both have regarding people who are so afraid of COVID-19 that they're neglecting the other medical issues that they may be having, thinking that it's better to stay at home and not seek medical attention when needed, that sometimes they can become life-threatening, and that could be far worse than the potential COVID-19 exposure. The hospitals are prepared to take care of COVID and non-COVID-19 patients. So don't feel that you can't seek medical attention if it's needed. Also, the comment regarding the economy, we do understand that to be healthy, you need to be healthy, not just physically, but also mentally, spiritually, emotionally, and economically. So, this is why I think this approach for a slow reopening would be the most beneficial to maintain that balance between health and economic health.
Thank you, Dr. Hong. Question from Greg Fuller, probably for Damian. Greg says, to what extent will things be opening starting this Friday, related to the announcement from yesterday, earlier this week? And to what degree will social distancing be enforced in these venues? Damian, can you just talk a little bit about the announcement this week?
Sure. So the announcement contained really 4 elements. It was allowing curbside pickup for some retailers who are right now only able to do delivery services. These are many of our small businesses in areas like clothing stores, shoe stores, bookstores is another big one. There's a whole list online that goes along with that order. I think they're going to put it up right now, so you'll see the list here. The second part is looking at, we've already done some of this over the last few weeks, looking at, I like to call them high ticket retailers, folks where the purchase is really several hundreds of dollars, like furniture stores, which we've moved to appointment only, automobile dealers, which we've moved to appointment only. This is 2 appointments per half hour, so really, really restricted. But again, for those high tickets, allows them to do some level of business. We're looking at that for jewelry stores and also a couple other retailers now who might fall into that category of high tickets. Then the cosmetology sector, where we're looking at reopening them on a very limited basis for up to 2 appointments at any one time in a shop, regardless of size. The masks have to be worn, so proper PPE has to be in place for both customers and the salon, the folks running the salon, performing the services. It's only for hair care services and only for essential workers. We wanted to again start taking some interim steps as we approach phase 1. Really, it's about testing the waters. So you talked about safe social distancing. It's critically important right now that we continue to maintain safe social distancing in any of these businesses that are reopening, even in a limited fashion. Even the drive-up businesses, what we don't want to see is people getting out of their cars as they drive up to a business and coming in close contact with staff or with other customers. This is really an opportunity to see. We've heard feedback both from these town halls and from some of the town halls we're doing with business owners. It's really an opportunity to see how this goes, the level of compliance we have, because that's really important as we look at how we can continue to expand some of these steps. Is we need everybody to really take the rules seriously because it's the way of limiting the spread of the virus most effectively. And so we're going to start to see, hopefully, these businesses be able to transact a little bit more, be able to make a little bit more additional revenue, and be able to start bringing some folks back to work in the next few days as we implement these changes.
Thank you, Damian. And Dr. Hong, can you speak to the importance of social distancing there and why we'll still be talking about social distancing as we reopen for folks who have just joined?
Yeah, absolutely. Social distancing is one of the most effective ways to limit spread of this virus. As far as we know, this virus is spread mostly through droplet and contact, which means you have to be up close and personal. We call it prolonged close contact, which means within 6 feet for 5 to 10 minutes at least in that short distance. That increases your risk for contracting or transmitting the disease. So social distancing is probably one of the best ways of preventing the spread. Washing your hands, covering your mouth when you cough or sneeze are other effective ways. So we do want to maintain those infection control measures as we slowly reopen. I like the concept saying that this is like testing the waters, because I think that if we are successful and compliant and we see no surge of illness with this slow reopening process, then we can continue to open other aspects of the economy. So again, we're asking for everyone's help with this, that if we all want to start seeing an open economy, then we all should continue to follow our infection control measures, such as social distancing.
Thank you, Dr. Hong. Question for you, Secretary Cade. Danny, in the Facebook comments here, just had some general questions about, it looks like he tried to submit his weekly benefits request on the website, but had not received payment. Can you just talk generally about best practices and submitting accurate information and how important that is, and any other information you can share with folks who are submitting benefits requests?
I had to unmute myself. So there are a variety of reasons that a person's claim could be held. One of the top reasons ends up being security verification checks. These are mandated in order to verify that people are who they say they are. So we can ensure that people are not out here trying to commit fraud and use identity theft to qualify for benefits that you yourself have worked and earned. What I would say is that we have made some major system improvements to our phone lines to ensure that people have more of an opportunity to get onto the phones and get assistance from live operators and representatives. We know in the past, when this crisis first started, our system really wasn't built to deal with the increase in volume, but we've improved some of that. And so I would urge folks to call a few of our numbers. We'll make sure that we post them on this site, but 302-368-6600 is one of the numbers that you could call. If you go through the prompts, you have to listen to the messages. But if you go through the prompts and go through all of the questions that request that identify general questions, you will be connected with a operator. You may have to hold for a little bit of time just because of the volume. People that we've talked to have talked about 2-hour, 3-hour waits, but you will be able to talk to someone and rectify the situation so that we can release those benefits. So I'd urge individuals who are having this issue to call our office. Again, we understand that a few weeks ago when we tried to call, you may have got kicked out of the system, but those things have been improved. So please call.
Thank you.
Jonathan, before he proceeds, I know that it's very important that individuals do submit or read the chat line. I know that that phone number will be provided. And a reminder for those this evening, since we are already at 8:20, time goes by quickly, that if you haven't had a chance to ask questions or get a response, please do visit the de.gov/economy site. Your feedback will certainly make a difference, and we appreciate that. So thank you. Sorry to interrupt, Jonathan. Back to you.
That's okay. Thank you very much, Lieutenant Governor. And Damian, this is an issue you've spoken to a couple times in these town halls, and it's about childcare. Can you talk generally about how childcare fits into Delaware's reopening plan, and generally how the state has been trying to provide childcare services throughout this crisis?
Yeah, no, it's a crucial part of any kind of reopening plan. Right now, childcare services are restricted to folks who are working at essential businesses, and only if they have a letter from their employer saying that they cannot work from home. I think it's an attempt to make sure that, again, we're controlling the populations that are there, and enabling childcare centers to be able to practice some level. It's difficult with young children, obviously, but some level of social distancing there. We're going to continue to look at allowing any staff who have to return to work as a result of updates to the order, whether it's the phase 1 or even these interim steps, that those staff have childcare options if they have no alternative for childcare, because it's crucially important. You cannot return back to work if you don't have somewhere reliable that you trust to bring your child. And so we have folks in the Office of Child Care Licensing and directly in the governor's office working with child care providers. One of the issues is reaching a critical capacity. So some have chosen to close because they don't have enough children coming in, whether it's because there's lots of people working from home or similar reasons like that, to justify the cost of being open. But I know they're working with those centers to make sure the state's doing its part in the financial reimbursements we provide to child care centers for the care they provide for certain children, to try to make them financially viable so that as many can open as possible. And then again, anytime we make an update, it's going to be in this update, the interim steps we're taking. We're going to make sure that we make it clear that any staff called back to work has a place to bring their kids.
Thank you, Damian. And a good question here for Dr. Hong. Dr. Hong, I think you'll agree with Tammy in the live stream comments, who says we need to follow the science as we open back up. I know that's on everybody's mind here. And Tammy specifically talks about contact tracing. For everybody watching, Dr. Hong, can you just talk about what contact tracing is and why it's important to the reopening effort?
Absolutely. So thank you for asking this question. So as part of the epidemiological investigation, when there is a positive case, we need to kind of figure out who's at risk of getting that disease. So typically, as part of our case investigation, we would ask for all close contacts 48 hours prior to onset of symptoms, and then from there, we would ask for any close contacts starting then to up to your last exposure. So then we also want to know who was around those close contacts as well too. Again, just to kind of get a sense of how potentially this could spread throughout a group or throughout a community. So really the best way to decrease your spread of disease is to decrease the number of close contacts, and hopefully they will be able to quarantine as appropriate to prevent further transmission. So you can imagine one of our examples would be if you had one person who's in close contact with 15 people, and that person was sick, and each of the people in close contact was in close contact with 15 additional people. That's how the disease can spread. So contact tracing is very important as part of the process to really reduce the spread of infection.
Thank you, Dr. Hong. Lieutenant Governor, anything to add there? I know this is a subject that you know a lot about as well.
Yeah. Yes. The other part I think that Dr. Hong, hit on the nail on the head is that this is another tool in the toolkit. And social distancing, obviously, number one thing we can do. But once we are exposed, and there's all levels, and we won't get into that this evening, but I know all the members of the General Assembly who are listening, they've been contacted and heard from individuals, about what services and what is available. Contact tracing is another method for us to work with the community, in addition to having individuals, isolate at home or go into quarantine. We want to make sure individuals are aware and are helped. And the great news is that many of the listeners tonight are with wonderful nonprofit associations or community health centers, La Red in Sussex and others, have been working with many of us across state agencies through the last 3 or 4 years with community health workers who are bilingual, who are reflective of our community and its diversity. And, you will hear more, I'm sure, about this as our governor works with Dr. Hong, Dr. Rattay, AJ Shaw, and others in our state to map out a plan and who might serve as contact tracers. I know a number of you who have retired to Sussex who are listening in this evening. Some of you have been former directors of public health in other states. We are going to turn to you. So it is all hands on deck. And we will look forward to having you as part of the team as we really do work to keep Delaware safe until we get that vaccination or a treatment. We really do have to follow public health guidelines to have a healthy economy. Okay, Jonathan, back to you.
Thank you very much, Lieutenant Governor. So lots of questions, as you would suspect, in Sussex County about short-term rentals. Damian, maybe for you or someone could answer short-term rentals, current restrictions, when they might be lifted, why those restrictions are in place. And but Damian, maybe start on are they included in any particular phase? Have we thought about short-term rentals at all, and when we may be able to lift restrictions?
Yeah, I think they're in place now because we're discouraging non-essential travel, and many folks use short-term rentals for that non-essential travel, and it's a place where you're going to have lots of people. They're going to be coming into close contact with each other, and so it's certainly something we're looking at as we move into the early phases here. Even in phase 1, maybe reopening them in some limited capacity. But certainly as we move into phase 2, I was starting to have conversations with some folks this week about what those guidelines look like, because I think we really do want to make sure, if not in phase 1, they're able to open in some capacity in phase 2 as you see the non-essential travel restrictions lifted. Or relaxed, I should say, maybe not completely lifted.
Thank you, Damian. And another one, and this is a tough question. I'll throw this to anybody. But Brandy in the live stream comments asks, when can my 11-year-old son get back to playing travel baseball? This has been his life during summers and winters, and she believes that they can safely social distance and play summer sports at the same time. I know we're getting a lot on this. Anybody want to take the first stab at that one, summer sports?
Everybody can jump. As a mom of a young man who lived and breathed baseball and traveling and sports, and as I look to our panelists this evening, as you can see, our Secretary Cade is seated, but when he stands, he's a big guy who's been very involved his whole life in sports as our governor. Nothing more important than our children being active and physical, and I think Dr. Hong can attest to that you have to do it safely. I don't myself we don't have a magic date, but I know this was a conversation that has come up to our governor, and I know that it's on his plate, listening to our experts and following guidelines of CDC, that it is important. And so for Tammy, who's anxious to go forth, we've heard it this year, shout out to our awesome teachers and coaches and to those seniors in high school who did not get to finish their senior baseball season or have their prom or graduation. We feel the angst and the pain, but know that we are studying this. And I don't know if Damian or the Secretary or Rick have anything else you'd like to add to that.
No, Lieutenant Governor, I think you covered it really well. The only thing I would add is we had a conversation just in the last few days with some folks who run some sports facilities in Delaware around youth sports. They're coming up with a plan, and there's a national organization coming up with this plan as well that they're going to follow. for some, at least in these early phases, contactless sports, because that's a barrier to sports returning, especially in these early phases when we're still being very strict about social distancing. So it's being looked at, it's being talked about, and going to hopefully be in the phases as we reopen.
And this is Rick. So I just kind of want to make a comment that despite what's been going on, I have to give credit to the innovation that we're seeing, how businesses are changing their operations to try to still maintain some level of service. You know, I was asked recently what to do with graduation, and you know, a lot of great ideas from virtual, some thought process about a drive-through type situation. So you know, it really makes me feel more confident that we're going to get through this as quickly as possible, because that we are still trying to maintain our social distancing, our infection control measures, but we're still trying to have a life. So really kudos to everyone who's been very innovative in trying to still maintain some aspect of life while keeping everyone safe. So thank you for that.
Follow up for you, Dr. Hong. We had a couple comments in the pre-submitted questions about the community testing program in Sussex County that started a couple weeks ago now. Can you talk generally about the expansion of testing we've seen in Sussex County, the purpose, and just any other information you think folks should know down in Sussex?
Yes, so we've noticed a significant increase in cases in Sussex County. So to really try to stop that trend, we did support widespread testing in certain hotspots or high prevalent areas. And thank you to our healthcare partners, the FQHCs, our hospitals, industry as well too, to try to work together, try to get as much testing out there as possible to kind of determine where we are in the curve regarding infection and how to help those that need additional assistance to be safe at home. So really, it was a tremendous teamwork effort from all aspects of the community to be able to protect ourselves. So again, thank you for that. We will continue to do so. We are looking at other areas of the state that potentially are hotspots or high prevalent areas as well too. But it seems like the model that we are using, at least for Sussex County, seems to be working.
Thank you, Dr. Hong. A clarifying question here in the comments for you, Damian. Actually, in the pre-submitted questions, Todd Sherman asked that we mentioned that one person per golf cart, but did not list golf courses as businesses. Are golf courses open? Can you talk about the changes as it relates to golf courses?
Yes, golf courses are open. They've been open to in-state residents for the duration of the state of emergency. We just made the update that they would be able to offer golf carts. That was one of the things we changed when we allowed them to stay open, is that they couldn't offer golf carts because of the difficulties in sanitizing them or controlling the number of people on them. But it's one person per cart. They need to sanitize it in between uses. Again, just another one of those attempts to test the waters to see if we can get high levels of compliance and if we can continue to be vigilant about the public health situation.
Thank you, Damian. And I have a couple of follow-ups here about campgrounds and farmers markets. But before I give those to you, I would just remind you we have about 2 minutes left. We'll take a couple more here and then go to closing comments from the Lieutenant Governor. We would urge everybody to visit de.gov/economy to learn more about Delaware's reopening and recovery efforts. For the latest updates on coronavirus in Delaware, you can visit de.gov/coronavirus, and lots of websites here, but one more, de.gov/healthy community. You can find all the data that that state government is using and looking at as we progress through this crisis. So Denise, in the pre-submitted comments, Damian asked about campgrounds. Will they be open before May 15th or earlier? And then Joan Tracy asked about farmers markets downstate. Can you talk about campgrounds and farmers markets, where they may fit in reopening?
So I think campgrounds, I know we've looked at, there's RV parks, there's campgrounds. We've been working with both sides on those, on the reopening plan for both. They'll probably start to reopen at least at a wide basis as we allow more out-of-state or non-essential travel. I think that they're similar to the short-term rentals in that sense, which is, we're really still trying to encourage folks to avoid non-essential travel, and so keeping them closed until we start to relax some of those things is I think the plan right now. But we'll continue to work with those groups and see if there are opportunities to make accommodations in certain areas. We just made one last week, a very unique one for long-term RV rentals. So we'll continue to look at situations like that as need be. And then, John, do you just want me to go right into the farmers market question?
Sure.
So right now, farmers markets large farmers markets are closed. I think some street side small vendors have been allowed to be open. We've been working with the Department of Agriculture on some of these and interfacing directly with some of the folks that run those stands. We'll look at, I think as we enter phase one, how we might be able to promote some limited reopening of farmers markets, the larger farmers markets.
Thank you, Damian. And here's our last question for the night, and then we'll go to our Lieutenant Governor for closing remarks. Secretary Cade, we've gotten these, I think, on every one of these town halls, and Lisa Frampton in the pre-submitted questions asks, are the unemployment benefits being offered to self-employed folks, independent contractors, going to be retroactive? Can you talk about that at all?
Yeah, so the benefits for these workers will be retroactive to the week that the governor made the first amendment to his state of emergency, which essentially shut down hospitality and restaurants. That would have been the week of March 15th. So benefits will go back that far. However, the added $600 benefit on top of the state benefit, that wouldn't be retroactive until April 4th. So independent contractors will receive a state benefit, and they will receive the $600 federal benefit. The state benefit will be retroactive to March 15th. The federal benefit will be retroactive to April 4th.
Thank you, Secretary Cade, and thank you, everybody, for joining us. We had a good crowd on tonight's town hall. We would just remind you again, please do visit de.gov/economy to submit your feedback. There's a form at the bottom of the page. We are using this information to inform Delaware's reopening and recovery plan. There are also details about that plan on that page, de.gov/economy. For the latest updates on coronavirus in Delaware, please continue to visit de.gov/coronavirus. Thank you again, and I'll turn it over to Lieutenant Governor Hall-Long for closing remarks.
Yes, thank you. And I really want to thank everyone for participating this evening. Again, please submit your comments. We will respond. We know we couldn't hear from everyone. And a special, again, thanks to Damian and Secretary Cade for being with us, and to our interpreter, who is always available to make sure that all Delawareans can participate, as she does such a fantastic job, and to Jonathan for your time. I do want to indicate tonight we touched on everything from our physical health to our economy. And again, reiterating that in order to have that healthy economy, we have to remain safe and healthy in our communities. And tonight, to Sussex Countyans in particular who are listening in, and to the mayors, I'm not going to call you out individually, but you have been on the phone with myself and our governor and others and town council members. Thank you for stepping up. You have been among a hotspot identified not only to our state, but to our nation. And we thank the hospital systems and our providers, our nurses and others, again, for Nurses Week, for stepping up and being available and present to the first responders. To the businesses, thank you for your participation. Again, this evening, we cannot do this alone as government. We have to do this with you. And so thanks for the feedback. I know that our governor and his team really appreciates this and will take this into consideration as they move forward with the executive orders. Please safe distance. Please wear your mask out. Please do those things that keep us protected, and check on our seniors and individuals who may be isolated. Use our 211 line and visit de.gov/coronavirus for resources. We have those available. Have a great evening. Stay safe. If you missed anything and would like to participate, we will have one more forum tomorrow evening at 6 p.m. Thank you. Be well.